Institute certified cognitive behavioral therapist. I'm also the MD of Sunshine Family Medicine and Psychotherapy Clinic in Guru. So I'm here to talk to you about how to recognize and manage depression early. The point of this presentation, I hope that at the end of this presentation, you should be able to know the difference between sadness and depression, because there's a lot of mix-up. We use the word depression very leniently, where we think, oh, I'm so depressed, but it's not the same thing at all. And I also want you to be able to learn how to identify the signs when it starts early, so that you'll be able to get treatment on time and shorten the course. And then definitely to know when to seek professional help. What to do when you recognize those early signs of depression, and to separate it from sadness, and when to know, when to get professional help. So I'll start by explaining what depression is. Depression is a mood disorder. In fact, it's more than a psychological condition. It's actually now a systemic illness, meaning that it affects more than your mind and your emotions and how you think. It affects your body physically, as you'll come to know. According to DSM-5, DSM-5 is it's a way that mental health people are able to categorize illnesses. So if you meet criteria according to the latest DSM, that is 5, then you meet criteria for whatever disorder that you are trying to diagnose. So according to DSM-5, for you to say you have clinical depression, you have to meet 5 of these symptoms I'm going to name, and they have to be occurring most days of the week for 2 consecutive weeks. So the first is that you have low mood, you're sad, you're not happy. For some people, this may be irritability, easily annoyed, you can't tolerate what you used to be able to tolerate before. Low frustration tolerance. The next is that you don't feel pleasure. Things that used to make you happy before, for some reason, they don't make you happy anymore. People will say they feel empty, they feel like, they don't enjoy life. There's no point. So you hear statements like that, what's the point? The next is loss of concentration. You're not able to focus on your mind on what you want to focus on. Your mind tends to wander from one thing to the other. Another is low energy. So you see from the criteria already that there are physical, bodily symptoms that make up the diagnosis of depression. So people with depression feel physically tired. Not only physically tired, they feel mentally fatigued as well. It's almost like there's a fog in their head. So mentally they're exhausted, physically they're actually tired. Significant weight loss, and this is because of the loss of appetite. So some people lose appetite, some people gain appetite. Those that eat more and have an increased appetite is because they cope with what they're going through by eating. So eating comforts them, so they tend to eat more. Then those that don't eat is because they are worried and they might even forget that they have not eaten. Then insomnia, lack of sleep, not being able to sleep as well as you used to. For some people, hypersomnia, meaning you sleep more than you used to. For those who sleep more than, it's because you sleep to escape the troubles, to escape, where your mind is going and your thoughts. For those who don't sleep, mostly it's because they're worried. They're thinking, trying to figure out, how to get out of where they find themselves in. Psychomotor agitation means psych in your mind and in your motor, your body. So mentally and physically, you're either agitated, not calm, restless, or you are slowed down. So depression slows down your thinking. You're not as sharp as you used to be. And physically, you're slowed in even some people have psychomotor agitation or retardation to the point where you can see it. They come in the room and they walk slowly, they talk slowly, their tone is low, you have to lean in to hear them. And feeling of worthlessness, feeling of guilt, and thoughts of death. So I just walked you through the criteria that we mental health people use to make a diagnosis of depression. So if anyone has at least 5, the more you have, the more severe the depression. Of any of these things I've listed, and you've had them for more days than not, consecutively over 2 weeks, then we say this is depression. So what's the difference really between sadness and depression? So this is what I like to teach my patients when I see them, for those that are depressed. I want it to be clear what this is, so that if you have a relapse, you'll be able to know this is a relapsing depression, or, oh no, this is sadness. Because sadness is part of life, but depression is not. So it's important you are able to tell clearly that, I'm sad, it's okay, versus I'm depressed, I need to do something about it. So duration is key. So sadness is short-term, transient. Depression tends to be more persistent. And what I teach my patients, according to the psychotherapy modality I practice, which is cognitive behavioral, there's so many different types of psychotherapies. The reason for this is because people that are depressed have negative core beliefs. A core belief is a basic, fundamental way you see yourself. So if something happens to me, for instance, maybe I lose a job, and I feel like I lost my job because I'm a failure, I'm not good enough, I don't measure up. That idea that I don't measure up, I'm not good enough, is a core belief. This does not exist in sadness. Sadness is low mood because something has happened, but it's not tampering with the way I see myself. So maybe I still lost my job. Yeah, I'm still sad, but I don't think I'm not good enough. I think, well, they laid off people, the economy is bad. I don't internalize that to mean something about me, then that's sadness. But once I begin to internalize it, then I'm heading towards depression. Triggers for sadness, typically things that happen externally. For depression, you can't even place it, because something that is supposed to make you happy will happen. And then you're happy for a few minutes, and then you go right back to being sad. Using the example with the job, it's because you feel like you are not enough, regardless of, what is going on. And even if something happens, maybe your kid did well in their exams, you're happy for some time, but then you slip right back to feeling like, I'm not really good enough. The pleasure. So in depression, like I mentioned earlier, there is loss of interest in life, loss of pleasure in things that used to be interesting to you. And this is really frightening to some people, because they say, this thing makes me happy. I cook and I'm happy. But now I cook, for example, and I'm not happy. So this really is a sign that this is not sadness. In sadness, you're able to still feel pleasure. You're sad about this XYZ, but when something pleasurable happens, you feel pleasure. But for depression, no. And even if you do, it's very fleeting. Self-esteem. So with sadness, your sense of self-worth is intact. Whatever happened, it is what it is, you move on. But for depression, because of the core belief, it says something negative about who you are as a human being. So there's a lot, reduced sense of self-worth, feelings of worthlessness, sometimes guilt. So people, in fact, guilt is something, let me say something real quick about guilt. When a patient comes to me and the patient, apart from being depressed or anxious, believes that they are to blame for what they're going through, it gives another layer of suffering to what they're going through. Because now it's no longer, this thing happened, I lost my job. It's that if I had submitted that proposal on time, I wouldn't have been in this mess. In other words, you are the cause of your own suffering. So I like to address this, it's a priority for me in session, because like I say, if you want to play a game, for instance, a basketball game against another team, you first of all have to get your team in order. Your team cannot be divided and you expect to win. You will not win. So I always like to address guilt when I see it in session. Daily functioning. Once anything affects your ability to work, to function, to achieve your daily goals, whether it be a mom or a dad or an MD, an executive, then it meets criteria for disorder. That is what it is in DSM. It's always been like that. A disorder, you can be sad, but the sadness is amped up, becomes a disorder, becomes depression. Once it affects your life, then it's no longer just sadness. It's now tending towards depression. Physical symptoms. So for sadness, very minimal, slight changes here and there, ups and downs in energy level. But for depression, there's a lot of physical symptoms. Weight loss, loss of appetite, can't sleep, might lose weight, gain weight, and all that. Then for sadness, it resolves naturally. For depression, it would require treatment. So if you notice, I've been talking about sadness and depression. For sadness, basically, is that something sad has happened, you feel sad, it's transient. For depression, it has a lot of baggage. Thinking of death, thinking that you're worthless, feeling guilty, physical symptoms, not being able to concentrate, losing weight or gaining weight, and all that. So there are different types of depression, actually. Depression can be a single episode where we say this is major depressive episode. It can be one. It could be recurrent. It could be persistent, meaning the same episode but is lasting more than 2 years. It could be bipolar. In fact, for mental health people, we are very careful that to distinguish unipolar depression from bipolar depression. Unipolar depression means this is only depression. There is no mania, meaning agitation, euphoric mood, being hyper. It is only depression. But there's something like bipolar where people switch from having depressive mood and then after some time they now have, expansive, euphoric mood for no real reason. It's important because in treatment, if you make a mistake and you think it's unipolar and it ends up being bipolar, you can actually trigger or, bring out a manic episode by using antidepressants for someone that has bipolar. So this is important for mental health people and also for people, that might be experiencing these symptoms. Then there's postpartum depression. You may have heard of people who have given birth and they were okay. And then baby comes and then you know that they're no longer themselves. They're not taking care of themselves. They don't even want to see baby. They don't want to touch baby. Some people even, go as far as wanting to harm the baby. I've had patients like that where for fear of baby's life, the patient had to be separated from her child and then the patient sent to me to take care of her. So now that we've talked about depression, why is this even important? Why am I here telling you about the difference between depression and we're talking about depression and sadness? It's because it's such a common disorder and it's one of the strongest predisposing factors to suicide. In people aged 15 to 29, and I found this really unsettling, that in young people 15 to 29 years of age, suicide is the third commonest cause of death in young people all over the world. So that says something. That says that this is something we, as either a parent or a sister or a boss, we need to be able to recognize this early. And sometimes people are good at masking how they feel. When I talk about this, I remember a colleague of mine who, a doctor where I used to work, and he died by suicide. And it was a shock to all of us. It kind of, we had to have a meeting and talk about it because the question was, how is it possible that all of us are here doing our thing, seeing patients, and one of us, is going through this and we didn't know? We didn't know, we didn't. So, it's good to talk about it, but in real life, people who, are set on harming themselves, they will mask. Because the question we all asked ourselves is, were there signs that we missed? Is it possible that we didn't catch this on time? Could we have done something differently? And unfortunately, we went, we kept but I kept going, replaying how my experience with this doctor, a young doctor then, worked with me, usual ward rounds, and only to hear a few days later that he had died. So it's important what we're doing here. It could be the difference between life and death for somebody. So depression is common in Nigeria, in Africa. For Nigerians in our country, 7 to 14 million people live with depression, according to WHO. In Africa, approximately 30 million people are suffering from depression. Unfortunately, it's more common in women than in men. So the reasons, in case you're wondering, I wondered as well. The reason is that, for a woman, you have the cycles. You have the estrogen go up, it comes down. Estrogen helps to produce the chemical that makes us happy, the serotonin and the dopamine. So when estrogen is low, which happens in women's cycle, serotonin and dopamine also goes low. So that's why if you've noticed at particular times in your cycle, you're more irritable. I'm sure you've noticed more irritable, more sad, things like that. So this is one of the reasons why women tend to have more depression than men. Another reason, it might just be that women present more, that women are in more contact with the healthcare system. Bring your kids. Most of the time is take your son to the doctor, woman, or something like that. The men are out there, they're the pillars, looking for jobs, looking for work and money, and women are taking care of the kids, and if the kid is sick, it's mommy they'll go to. So that might be another reason. And then, of course, pregnancy, more contact with the healthcare system. This might be another reason why. So still talking about how common this is. So unfortunately, these staggering figures I've mentioned, they might even be an underestimation because we know that not every single case depression gets reported. Some people, are depressed. They don't even know that they're depressed. That's why we talked about the symptoms and criteria to start with. So imagine someone coming to a doctor and you're saying, I'm just tired. And it happens a lot, especially for us family doctors. I'm tired. I don't have a headache. I don't have chills. I'm just really tired. And if you probe a bit more, they will tell you that I'm not only tired physically. In my mind, I'm just exhausted, really. So these are one of the telltale signs that are easily missed. Or I'm just losing weight. I'm not trying to lose weight. I'm just, my clothes are just getting loose. I don't like it. I don't want to be this way. So if you're not, you don't have a high index of suspicion, you might miss depression, will walk in and walk out, and you wouldn't even be able to pinpoint it. Then depression itself is a risk factor for other problems. That's another reason why we're having this discussion. Because people that feel so sad and feel that the sadness is coming from inside, they find ways to cope. Unfortunately, sometimes it's substances, especially with young people. Young and old, coming up with anybody, really. So drinking, smoking, weed, people use these things to cope with the intense emotions that they feel. Sometimes self-harm. In case you're wondering how self-harm will be a coping strategy, I wondered myself before I became a mental health person. And the answer is, the physical pain of harming yourself takes away or distracts from the pain of how you feel. So you can imagine how intensely bad someone must feel for even to contemplate suicide. And suicide, leaving the world, becomes attractive. That's to tell you how dire the situation is. Eating disorder, people cope by eating to the point where they're gaining weight, and if you do, now this is a hint to those who might be thinking of losing weight by maybe medications, which is great, and maybe surgery, if an underlying eating disorder is not ruled out. And this is why I partner with a colleague of mine who is a bariatric surgeon. His patients who come for his surgeries, they pass through me. And I think that's great. Because you might have an eating disorder and you're coping with eating, and then you go and tie your tummy or something like that. But you can't help it. When situations come and you're sad, you will gravitate towards eating. And this is why sometimes these surgeries would fail. Not because the surgery wasn't done well, but the person cannot help but eat, because this is how they cope. So if this is the case, you need to find a way or teach them another way to cope before you do the surgery, otherwise it will not make sense. And of course, gambling addiction also. So people that are sad or feel like, the sadness comes from within because of an activated core belief, they cope by looking for thrills, looking for adrenaline rush, and gambling is one of them. This is why some people get addicted to gambling. Depression also co-occurs with medical problems, as you know, like everything else, like stroke and HIV. It not only co-occurs, it predisposes the chances of you having a medical condition if you have depression. That's why I said at the beginning that it's systemic now. It's no longer just a thing with your mind, it's a thing with your entire body. So what are the things that make one person more likely to be depressed than not another person? We talked about gender, that, 2 to 1, females, just being a woman predisposes you more than being a man to having depression. Family history. If you have a history of depression, you are predisposed to having depression yourself because you have a genetic vulnerability. When situations happen, you, because of your genes, are more likely than someone who doesn't have that vulnerability to become depressed. Having a family history of alcohol use disorder. So if you have a drunkard in your family, you have someone who's an alcoholic, maybe a parent. So the reason, again, is the genetics, but also because parents inadvertently, we unfortunately model coping behavior to our kids. So if you cope by drinking, you are telling your child that when things get rough, the drink is the way to go. You have not modeled healthy ways of dealing with stress. All they've seen of you is that when things get difficult, daddy or mommy drinks, which is not healthy. And suicide attempt, a family history of suicide attempt or completion is again a predisposing factor. Because remember, the major cause of suicide is depression. So, goes the same way, unfortunately. Major life events. So having a major life event like the loss of a loved one, a difficult divorce, let me say something about that. Unfortunately, in recent times, more than I'd like to, I would have liked, obviously. I'm seeing a lot of, couples come to me in, distress, having a lot of difficulties in their relationships. And what I notice a lot is that either one or both of them is depressed or tending towards it. And the reason for this is the meaning of the breakdown of that relationship to the person. So for some people, men especially, the breakdown of a marriage means something to you, to them as a man. Says something like, oh, you're a failure. You can't keep a woman and a kid under the same roof and your children. You don't measure up. There's something wrong with you. So this is what it says to some people, and this is why difficult relationships, increase the risk factor or increase the likelihood of depression. Trauma, abuse, these things all cause the body to release stress chemical, cortisol, and cortisol increases the risk of depression. Long term, so short term, cortisol is great. It helps you to brace up for whatever difficulty you're facing, an exam or whatever. But when it's long term and this stress hormone has been in your body persistently, it wears the body down and increases the risk of depression. Personality types. People who are just highly self-critical, and being mindful of time, because each of these points I can go into it. So if someone could just, help me out with the timing so I don't stay longer than I'm supposed to. So I wanted to say that perfectionism is one of the things that predispose to someone being highly self-critical. And the reason is that if you are perfectionist, so society, we are driven towards perfectionism. As a doctor, you are taught you cannot make a mistake, you have to be right. But there's a difference between being perfectionistic, and having that trait of perfectionism. It's slight, but let me explain. To be a perfectionist means that you don't believe that you are enough if you're not perfect. You see, it's slightly different from wanting to do things perfectly. Whenever your sense of who you are is tied in to perfectionism, it becomes a problem. Because perfectionism is not human. We cannot be perfect. We will only strive, we will do our best to not make mistakes. But because we are humans, we will one time or sooner or later make mistakes. So if who you are is tied to perfectionism, then your bar is way here and you will always be here. And that is why you will always be self-critical, because you're always trying to get yourself to meet up. So I just wanted to point that out. So having that kind of personality sets you up for depression, just because of the kind of person you are. Then having low self-esteem. Low self-esteem is one of the strong predisposing factors of depression. And low self-esteem is tied into perfectionism, which is also tied into self-criticism. Recent stressors, financial stressors, legal, relational, academic, not having a confiding relationship. So one of the things I screen for when I'm seeing my patients is, do you have someone you can talk to? Do you have someone you can confide in? Because social support is huge, just like spirituality, in mediating and reducing the effects of depression, and even preventing someone from sliding into depression. Being able to talk to someone and, freely air your emotions is very therapeutic, even if they cannot help you, because it distances you from the emotions. Otherwise, it's inside you and you're struggling to find a way, like looking for a way out when you're inside a maze. It's difficult. But when you're outside, you can, have distance and you're able to find your way out. Lower socioeconomic status is a risk factor simply because increased financial strain, you don't have that much access to healthcare. So even when you have early signs not detected on time, until it snowballs to something major. Other risk factors, having an imbalance. So all these are actually interrelated. If you have a major event happen, the chemicals in your brain, the serotonin, dopamine, they will reduce, and then we say it's depression as well. This is why medication helps, because medication will increase the levels of these chemicals in your brain. Having other mental health conditions can increase the risk of having depression. So having anxiety will exhaust. If you're always worried and you don't sleep, you're exhausting your psychological ability to cope. Eventually, your ability to, remain sane or maintain a balance will wear out, and you slip into depression. So other mental conditions can increase the risk of depression itself. Hormonal fluctuations for women, that is in itself a risk factor. And chronic illness is a risk factor for depression, and depression is a risk factor for chronic illness. So why is it important to detect these things early? What is the benefit? The benefit is that we can prevent the symptoms from getting worse. We can nip it in the bud if we find it on time. If you realize that this weight loss is not just maybe I'm not eating well, it's actually something going on like depression, then you can address it on time. And then you don't have to go through the excruciating, painful, long episode and be dragged out. It can be shortened. And then it's more responsive to interventions because it hasn't set yet. It hasn't cemented yet. You've not learned to cope in ways that are not helpful. You've not turned to alcohol or substances or infidelity or neglecting your family. It's not complicated. Then, yeah, so it's more responsive to interventions. In fact, you know, I said I'm a cognitive behavioral therapist. Behavioral techniques alone at this point can help when it's detected early. Things like go for a walk, things like reward yourself, as you'll soon find out. These are simple things you can do by yourself that would prevent it from snowballing to depression. Sorry, how do I go back? Okay, found it. Right. So another reason why it's important is we can prevent suicide. Suicide is one of the things that depression predisposes you to having. So if we find it on time, we can keep the person alive. And then, of course, protect your physical health. There is a relationship between depression and chronic illnesses. Chronic illnesses like heart disease. In fact, psychosocial factors are now minor risk factors for heart disease. So the way we are screening for low cholesterol, we're screening for weight, we're screening for some chemicals in your blood, CRP, as doctors, when we're screening you for risk of heart disease. Psychosocial factors like depression have now they're now among those things we screen for as well. That is how important it is. Minor though, they're not major, like cholesterol level and things like that, and family history of a heart disease, but they're minor. So imagine if, for instance, maybe you have diabetes, you have hypertension, you have high cholesterol, and then you now add depression on top of it. You know that it will tilt the scale towards, you know, heart disease or something. So that's how important these things are. Of course, we want to preserve daily function. If we find depression on time, then we can nip it in the bud and prevent it from, you know, scattering your life, so to speak. So these are the early signs and symptoms that this presentation is about, and I've categorized them according to age, so that you can, you know, not only look out for yourselves, but also look out for your children or, you know, people that you care about, because they're slightly different depending on how old the person is. So for teenagers, one of the telltale signs, early signs of depression is anger, frustration, sensitivity to criticism. You say one thing and it's like they want to bite off your head. So this is typical teenage behavior. So that's why I wanted to say it's, you know, masked as typical teenage behavior, but it's exaggerated. So we know teenagers, we know they like to be in their room, they like to be alone, they're not the best at, you know, regulating their emotions. But for someone who has depression on top of the typical teenage behavior, you see extreme sensitivity to criticism. So, Junior, have you done your homework? I will do it. What about, did you wash the plates in the sink? Mommy, I said I will do it. I'm like, it's okay, I'm just asking a question, you know? So this is typical, but when it's depression, it's more extreme. Social withdrawal. For someone who used to be extroverted, has a lot of friends, suddenly they prefer to be by themselves. They don't want to hang out with, you know, XYZ best friend they used to be 5 and 6 before. School performance. So school performance used to be, you know, solid A student, and then you see school performance beginning to drop. Telltale sign that it might be something more than teenage behavior. Risk taking. Teenagers are known to take risks, but those that are depressed, remember, the substance use experimentation is a coping strategy. They're trying to cope. And it's not the best coping strategy, but it's like someone who is drowning and will hold on to anything they can see. So when you see people begin to experiment, you go into their room and you see paraphernalia of drug use, you see, you know, weird stuff, then you should be suspicious that this is more than just teenage. This is something. What about people who are older? What about people within the ages of 1964? Most of us fall within that age bracket. So I like to start with emotions. A lot of times I hear, I don't feel anything. I'm not sad. I can't even say I'm sad. I'm just, I'm just there. So that emptiness, not feeling anything, not feeling interested or enthusiastic about life, you're just there. Someone, a patient of mine used the term buggering on. I'm literally just buggering on. Like I need to go every day, I go to work. sometimes for men especially, and it could be for women too, the workaholic tendency is in itself suspicious for someone who wasn't like that before. So you have to know the person to an extent to be able to identify these signs early. Someone that was just okay with work, then suddenly it's work, work, work. That work could be a coping strategy, running away from something. It's more helpful than substance abuse for sure, but it's running away from something, from sadness, from being by themselves to cope with how they feel. So people do anything just to move around. Sometimes I also find, even though it's not on this slide, infidelity in itself can also be a telltale sign. I know it's not a funny telltale sign at all. Of all telltale signs, please. But in fairness to people, I have seen it happen where the whole relationship meant nothing. The whole relationship was an escape. He was just looking for something that would make me happy, a thrill. Remember how we talked about gambling being a thrill? I'm just looking for a thrill. Then empty mood, loss of interest or pleasure, guilt, hopelessness, irritability. So this again with men. So men more than women would report that I'm not sad, doctor. I'm just easily angered. My wife has been complaining. I keep shouting. I don't tolerate what I used to tolerate before. And this is because, so the way God built us human beings, when there is an existential crisis, meaning that you are worthless, you are a failure, that attacks the root of who you are, that is a big deal. And all your psychological resources are focused towards solving that. And this is the reason for the indecisiveness, the lack of concentration. So you're distracted trying to, fix and solve this issue of, am I a failure? Am I worthless? Is this really about me? Is it them? So little things that you could deal with before, your psychological resources are drained. So little things you could deal with before, you can't deal with them anymore just because your resources have been, used up by you trying to solve this thing. So difficulty concentrating in someone who used to have a sharp attention span, where you tend to not, be grounded like you used to be, again, because of lack of concentration. Telltale sign. Memory problems, forgetful. So you walk into a room, wanting to get something, and you get there and you're like, why did I come into this room again? So this could be a telltale sign. But a word of note for women, if you are perimenopausal, this could just be a sign of perimenopause, because remember, the estrogen, which is a hormone in common that women have more than men, men have estrogen but not as much as women, tends to begin to decline late 40s. And remember, estrogen is connected to serotonin, which is also helpful with the mood and concentration. So it doesn't mean, if you're experiencing this, I'm not saying it is a sign of depression. It doesn't mean it's not either. They could coexist. But I just want you to be clear on what's going on. So this can happen in women as well. But if you are not perimenopausal and you are in your 20s or your 30s and this happens, then you might want to look deeper at it. Physical and behavioral exhaustion, sleep disruption, either sleeping too much or sleeping too little. For the elderly, what the signs we typically see has to do with memory. So serotonin, dopamine, and norepinephrine, these are hormones that help us to feel happy. They are also the same hormones that help us to handle memory, as you've going to realize with what I said about perimenopausal women. So for the elderly, a lot of times it doesn't show up as typical, which is low mood, sadness, fatigue and all that. What you see is a memory problem. So it presents a diagnostic dilemma, because you know that with old age as well, there can also come things like dementia, neurocognitive disorders. So for mental health and medical people, it's something we really need to be, look at closely to be able to differentiate. But memory problems is a sign of depression in elderly, and memory problems is also a sign of neurocognitive disorders in elderly as well. In addition to that, unexplained pain. Now, this doesn't have to be only in elderly, even in young people as well, or younger people. So you have had low back pain for years, and then it's been gone, and then suddenly it's back again. So remember, depression is not just about your mind, it involves your entire body. So it can increase the chances that medical, minor medical conditions are flared up. All right, so I have 20 minutes, so I need to go a bit faster. Okay, so what can you do? So I've broken down what we can do into the problem and the solution. So if you notice that you're self-critical, you're extremely negative, which is the problem, the solution is rather than believing everything you think and assuming that because I think it, it must be a fact, learn to question your own thoughts. So one of the things I love to say in session is just because you think something does not necessarily mean it's true. For instance, you think, you know, no one is smiling at me. This presentation must be so boring. Just because I think it does not necessarily mean it's true. Look at the facts. Are they responding? Are they making eye contact, for example? Yes, they are. So maybe it's not boring. For example, the rumination. Rumination is a tendency to go back in the past and begin to play over and over again a flaw that has happened or a mistake you've made. So this is, tending towards depression. Remember, we're talking about early signs. So if you identify that you tend to do this, you had a presentation, it went badly, rather than moving on and identifying what went right and learning from what went wrong, you keep replaying it over and over again and blaming yourself and kicking yourself and saying, you should have done that, you should have done that. So the solution is pick out the things that you did right, give yourself credit for that, learn from the things you did wrong and go on. Playing it over and over again would only, lead you to depression. Self-criticism and blame. So counteract that with self-compassion. So self-compassion is a nice word. What does it really mean? To have self-compassion means talk to yourself kindly, the way you would talk to a good friend when you make a mistake. So rather than saying, you idiot, you're so stupid, why did you say that? Why did you say that? Nobody says stuff like that. You can say, well, you shouldn't have done that, but everyone makes a mistake. Now you know not to say stuff like that, for example. And then when you are in need or when you're upset, ask yourself, what do I need? Now, this is something we go to people to get. I'm saying you can do that for yourself. What do I need? For my daughter, it will be ice cream, and then you solve the problem. For yourself, it could be, it could be a new dress, window shopping, that's new meal at that restaurant. Soothe yourself is what I'm saying. If you have someone to soothe you, wonderful. But if you don't have anyone to soothe you, then you need to be self-compassionate. Direct that compassion to yourself. And then, still talking about self-compassion, remember that what has happened is specific. I'm down here to global and stable attribution, meaning that we sometimes tend to generalize something that's happened. We make it global and we make it stable, meaning my not giving this presentation well means I'm a failure as a doctor, as a therapist, for example. Specific means it's not me, they weren't paying attention. And if they had listened to me, they would have maybe understood better. It's not me. You see what I've done? So I've made it from being stable about me to making it external. And I've made it from being permanent to being specific. So that is how to respond to, things that you think. Don't assume that just because you think it is true. What about social withdrawal? So for most people, when something hurtful happens, they withdraw. And it's so natural and understandable because you withdraw to kind of, take stock, debrief, what just happened here, what just happened, But go ahead and take stock, but don't stay there forever. Take stock and then engage and fully participate. This is important. This is the behavioral angle I'm telling you about. Meaning that you don't have to feel like engaging to engage. You don't feel like it, go ahead and engage. And fully participate is important because you can be engaging, but your mind is still stuck in what went wrong. So engage and put your mind in that activity. That is how you can separate yourself from withdrawal, self-criticism, sadness, depression, and that downward slide. Then act in opposition. This is literally a skill in therapy that I teach patients, which is do not allow your emotions to dictate your behavior. You actually have more control than you think. But a lot of times, emotions, how we feel, flows out in how we behave. But realize that, yes, it's true that it's natural, but you don't have to do that. You don't have to obey your emotions. Your emotion is saying, I'm feeling sad, wear black. Go and wear bright colors and see if you won't feel better. I'm feeling sad, stay by myself and eat fast food. How about you go for a walk and eat healthy food instead? When you act in opposition to how your emotion is pulling you to act, you will feel better. Then hopelessness. Hopelessness is, what's the point? Meaningless. There's no point. I'm a failure anyway. Remember what matters. So when you are feeling hopeless, the anchor I like to use, apart from spirituality, which usually works, not always though, is remember what matters. What matters to you? For women, a lot of times we can't go wrong with their children. For men, a lot of times work, meaning, family. So remember what happens, what matters. So your appraisal went terribly and your boss was not happy and you might look like you won't get that promotion. And then you're like, so what's the point? Why am I even struggling? They don't think I'm a good employer anyway. But remember what matters. Is this only about the money or is it about family that's depending on you? Is it about your children that need to go to a good school? So when we anchor ourselves by remembering these things, we prevent ourselves from sliding down the depression path. Procrastination. So this is one, I didn't mention this, but this is actually one of the telltale signs of depression as well. If it is not your go-to modus operandi from the beginning, if you are not the kind of person who procrastinates and you find yourself, I'll do it later, it might just be an early sign. And the reason is that when you procrastinate, what is going on is that this thing comes and you have to do it, and you're like, it's too much, can't deal right now, I'll do it later. That's what procrastination means. It's too much for me, overwhelming, can't handle this right now. So it means that there's something bigger on your plate that you are distracted, that is distracting you, if it's depression. So one way to handle this is, first of all, break whatever larger task into smaller bits. And you know that it's a small enough bit if you don't feel like procrastinating that bit, you've broken down into it. For example, I have to do a presentation and I'm like, I can't deal with too much. And then I break it down, and the first step is open my laptop. Oh, I can do that. Open the laptop, done, easy. So that's what I mean by break it down. You know you've broken it down if that first initial task is not overwhelming. Give yourself credit. Now, this is one way to increase that voice of self-compassion, and this is when you tend to be self-critical. Give yourself credit means reward yourself in some way. It doesn't have to be a physical reward, like tangible. You can just say, you go, girl, you slayed. Oh, that was great, fantastic. Be your own cheerleader. If you can be your own self-critic, why can't you be your own cheerleader? Then reduce physical activity, the flip side, physical activity, reward scheduling. So we know we're very good at scheduling appointments. Do this, do that, do this, don't forget this, or do this, pick this on the way back from work, or remember this person, call this person. How about you also schedule a reward? Remember to take yourself out. Remember that pedicure. Remember to do your hair. Imagine if you had a schedule full of all the do, and then you have something you're looking forward to. Wouldn't it be a motivation to keep going through the stress? Yeah, so you can schedule good things as well. I'm going to run down because I'm out of time and I want to be able to take your questions. What you can do about low mood that is not yet depression. Apart from scheduling rewards, self-soothe. So self-soothe means use your 5 senses in a way that helps you feel better. Your eyes. What can you see that will make you feel better? Is it a movie? Is it someone? Is it nature scene? Is it comedy? What is it that you can see? What can you hear? Is it scriptural quotations, Quran, Bible? Is it someone's voice? Is it music? Is it white noise? What can you touch? Is it yourself, like give yourself a hug? Is it someone hold someone? Is it a pet? Is it something? Is it warm water in the tap? What can you touch that will make you feel better? What can you eat? Eating, I always like to say, be careful because remember eating disorders, we don't want it to be a go-to, but eating once in a while is great as well. Sometimes holding a warm, I like the smell of coffee, so holding a warm cup of coffee and inhaling the smell, I just like that, especially if it's a cold day. Pepper soup is another one, can do just the same thing as so, self-expression. So remember the importance of having a confidence. If you don't have anyone you can trust, and it happens, some people are like that. Even my husband, some people will be like, even my wife, women, and they forget that their doctor is a woman. I'm like, yeah, I know those women. You can actually write it down. You can express in a journal. It can be on your phone if you don't trust that somebody else will not see it. But expression, talking about it, distance gives distance and makes you more objective. Spirituality is an anchor that has prevented many people from going, to commit suicide. When I bring in the God factor, because we believe in God in this country, and it's great because the help of God has helped so many people and brought them back from the edge. So leverage by all means, on spirituality. In fact, studies have shown that people who are spiritual are less likely, there's a kind of buffer you have against things like this. So by all means, go ahead. Problem solving. Problem solving means if there's a practical problem that you need to solve. Actually, there are steps to problem solving. What is the problem? What are the options? What are the pros and cons of each option? What are the strategies to solving the cons of the particular option you chose? You can actually problem solve and solve your problem. Now you can actually prevent. I know this is like Jara now. I know the presentation was about recognizing and managing early signs, but I thought to myself, why not even prevent it completely? Why not prevent it completely? So you actually can. So there's an acronym called ABC, please. The A means accumulate positive emotions. So remember I talked about core beliefs. So core beliefs, fundamental way you see yourself. If the core belief is negative, likely very soon, what we will see is negative emotion, what we'll see is depression. So rather than, leveraging or living off your reserve, why don't you bank and store positive emotions? Like, I talked about reward scheduling. Why don't you fix in your schedule from the beginning? The year will be stressful. This month is always stressful. Why not schedule from the beginning things that will give you positive emotions? If it's a hangout with so and so, if it's a date with so and so, if it's a moment alone with yourself, that this thing always rejuvenates you, makes you happy. Why not plug it in and increase those emotions that are positive so that when the inevitable happens, you will not be knocked off balance and fall into depression? Building a sense of mastery. Sometimes the reason why some people slide into depression is when they feel like they don't have that sense of self-efficacy. They don't trust themselves to deliver when the chips are tough. So to be able to build that sense of mastery, whatever it is that you want to be skilled in, why don't you start by, go ahead and do that little by little. If it's like an additional qualification you need, additional training in this or that, or this business, you want to get some information on that, building a sense of mastery can actually protect you, your sense of self, your self-esteem when the going gets tough. Coping ahead. Wonderful, love this, and I use this all the time. Coping ahead means maybe mother-in-law is coming to visit. And I know mother-in-laws, sometimes they don't always get along with their daughter-in-laws. I know it's always going to be stressful. Why don't you, since you already can predict these obstacles, why not begin to plan ahead for the strategy to mitigate even before it happens, and begin to visualize yourself coping. So I'm talking about mental imagery now. Begin to imagine yourself doing this thing that you wish you would do if this thing were to happen now. So it's like you have already brought the problem close to you. You've already proffered a solution, and you're already, rehearsing the solution even before the problem comes. So you're already coping ahead before the thing comes. What happens is that when mother-in-law lands, is like, I'm ready for you, mama. I got you, ma. I got you. And mama's like, my daughter, you're so, you don't know that you've been practicing for her coming since. Treat physical illnesses. So the body is not separate. Physical, psychological, emotional, they're all intertwined. If you delay treating that malaria, that cold, that headache, have you seen anyone who had malaria and was very happy? No, a lot of times you're not happy just because you're not well. So physical and psychological problems are interrelated. To protect your psyche, treat physical illnesses quickly. Exercise will increase those hormones I told you about, serotonin and dopamine, moving around. If you make it like a regular thing you do, you have already started building your bank of emotions by exercise. And of course, the mental and physical benefits. Mentally, exercise will improve working memory. Working memory is your ability to hold information in your mind for some time. So it will also improve physical health and avoid substances. So rather than, reach for the alcohol or the weed when you're stressed, why not reach for, a friend or confidant or pastor or something? Sleep. Sleep hygiene is a set of rituals that you do, that you've decided to do in a particular order that will help you to sleep. No, sleep is important. Anything is worsened by not sleeping well. So the days of taking sleep for granted have passed for medical people like myself. We have now realized that if you're not sleeping well, whatever we're dealing with, whether it's physical or psychological, becomes worse. So take your sleep seriously. And of course, eat a balanced diet, the whole antioxidants, fruits and veg, and things like that. Then of course, if all this doesn't help, everything I've said on how to identify the early signs and do it, if it doesn't work, of course, then that, you probably should get professional help. This is another bonus slide. Prioritize mental health, manage stress. So this is like a quick, very robust, compressed form of stress management. We know that stress, is real. Stress can affect you physically, can affect your emotions. Stress can, predispose you to sliding into depression. So daily me time is what I recommend. Every day, have time for yourself, where you go through your thoughts and emotions. You ensure that you are living in line with your values. The importance of this is that you're more self-aware and you're less avoidant. We can actually live our lives avoiding our lives. I wonder if you understand what I'm saying. You can live your life and yet you're avoiding so many things, avoiding feeling a certain way, avoiding, being present because you don't want to fully feel what you would feel if you were fully present. But the problem with avoiding is that you keep running away. Running away does not remove the thing you're running away from. Rather, it just comes out in another way, which you might not like in the way you relate to your colleagues, for instance. Practice mindfulness, be present. So rather than run away, be present. Respond to your self-talk. So rather than, letting the thoughts that go through your mind, especially the negative ones, go unresponded to, learn to question and respond. When you respond, the emotions go down. Be grateful, practice gratitude. So I literally have people as action plan. Action plan is like a homework I give people that I see in therapy. Literally write down every day things that you're grateful for. So the advantage of doing this is that it takes your attention from the things that are not going well to the things that are going well, which balances out how you feel from negative to, more positive and less negative. And acceptance. Acceptance means something negative, you cannot change it, has happened. Refusing to accept it will increase your suffering and your pain. So acceptance means let reality be reality. Don't struggle with what has happened. Leave it alone and accept it. For instance, maybe a diagnosis, a medical diagnosis, you refuse to accept it. The more you struggle with accepting and refuse it in your mind, the more suffering you give yourself. Schedule activities that bring pleasure and mastery. So this is similar to what I talked about, reward scheduling. Copperhead talked about that. Communication is important. So some people are aggressive or passive in communicating rather than assertive. Passive means whatever you say is okay, I don't want to rock the boat. Aggressive means I don't care what you think, this is what my way goes. Assertive means I am respectful of your rights and I'm also expressing myself. All right, so I'm really out of time. So you need to achieve a work-life balance. Sometimes it's because we're working and we put all our energies into work and forget that we have a life. And then finally, don't forget your relationship, your primary relationship. Because a lot of times, it is the problem in this area that actually is what makes people slip down to depression. So in conclusion, depression is a very common mood disorder, reduces quality of life, may even lead to suicide. We can actually recognize it early and treat it early. And in that way, we can shorten its course and prevent complications. Thank you.